While waiting for deliveries of the vaccine to arrive, Bhutan was building an army. 22,000 volunteers called DESIPs, who raised awareness, carried out screenings, and quickly adapted to the process of cold chain storage.
As a frontliner, I think it's my responsibility to be vaccinated. And also because His Majesty has done so much for us, so we feel it is our responsibility as a citizen.
When it was time to give everyone their second shots, the DESIPs got to work, and the results were astounding.
Vaccinations began on the 20th, and people have cooperated. A lot of people turned up on day 1, day 2, day 3, and by day 4, we had achieved our target.
In just 7 days, Bhutan administered nearly 500,000 shots and fully vaccinated 90% of its adult population. For older people and others unable to walk to vaccination sites, health officials went door to door.
I think we will be able to prevent the transmission of the COVID-19, which is our main goal, and probably we expect that herd immunity would be established in the country, and now country can open slowly.
King Jigme Khesar Namgyel Wangchuck has spent the last year hiking to remote villages, at times joined by Prime Minister Lotai Shring, who's a medical doctor.
And if there's anything that I hope the world can learn is that a country like Bhutan, with very few doctors, very few nurses, but a really committed king and leadership in the government, mobilizing society, it's not impossible to vaccinate the whole country.
Bhutan is encouraging people to mix and match vaccines. The first round of its national rollout was donated by India. The U.S. chipped in 500,000 doses of Moderna for the second.
I think the officials might have researched on this, and without research they might not have decided to do mix and match. So I trust them, so that's why I decided to take the Moderna vaccine.
It may be small, but the tiny kingdom has provided a lesson in how to tackle a common problem at a faster pace than elsewhere. Andrew Chappelle, Al Jazeera.